When Brittany Maynard took her own life before cancer claimed it, she ignited exactly the kind of debate she hoped for. The right to die versus those who believe no one has such a right. An issue that every state and every government has or will have to face. The New Jersey Assembly has passed a right to die bill, and that means the presidential aspirations of a certain governor are going to be right on the line. Pleasure to welcome back to MidPoint the Chief Medical Officer at Cooper University Healthcare, also one of the more popular radio talkers from the great CBS Radio in Philadelphia. Dr. Anthony Mazzarelli joins us. Dr. Maz, good to have you again.
Good to be here. Thank you.
This is going to create quite an interesting discourse, if you will, for Chris Christie, because he said many times before he is totally against this. Now the government, the New Jersey, has gone and basically said right to die is here. How do you see Christie approaching this then? And is this a popular notion in the state of New Jersey?
It's a great question. So it only passed by one vote in the Assembly. It still has to get out of the Senate. So Chris Christie's issues really only get magnified if the Senate passes it, which people think it probably will. So 41 votes out of 80 is how it passed. And here's the dilemma for Christie. He has said he is against it, and the issue is that he has to sort of make a decision politically about which part of the conservative part of the party and the Republicans he wants to be. Is he going to sort of more establishment Republican, more of the religious conservatives, and say this bill represents a moral issue, and because of those moral issues and because of the way he views life, he's going to be opposed to it? Or is he going to take the approach of I'm small government, want to stay out of your life, and take sort of the bigger tent conservative view that some people say is the roadmap for the Republicans to have more people support the Republican Party? So it's a popular measure in New Jersey, meaning people want it. And when you poll people, it's pretty close. It's not overwhelmingly popular. It's pretty close, but there are people who want the right to determine to themselves what happens in those end of days when they're terminally ill.
Let me ask you this, because apparently there's a doctor here, Dr. Jacqueline Harvey, president of the International Center for Truth and Science, warning that the right to die laws in Oregon and Washington have led to pressure on patients to end their lives for the benefit of others. Can you explain that? Because that's, if you think about that, that's really an odd thing to say.
Sure, and I'll tell you why he says it's an interesting point. It's probably one of the more compelling counter arguments. So if you weigh on one side people's independence, their ability to make decisions for themselves, that tends to trump, I think, other people's sort of the morality of it. But one of the arguments against the bill, if someone were to want to take that position, would be that, well, people who are terminally ill, who are a burden on their families, may feel compelled to avail themselves of the law, to take the medication to end their life because they're a burden and their family is suffering, rather than a total autonomous view of themselves. Now, I would tell you the data maybe points the other way. In Oregon, there have been close to 1,200 people that have been given the prescription and only about 700 that have actually taken it, and really no hard evidence that anyone felt pressure from their family. And you could ask the people that didn't do it, but that's, I think what that physician is saying is one of the arguments against why you would pass the bill, but one that most people say doesn't trump the right of people to make a determination for themselves.
Dr. Maz, do you see this as an inevitability that sooner or later all 50 states in America are going to have some sort of a right to die legislation?
I think if you think of a couple other issues as reaching that tipping point, I would say gay marriage is several steps ahead on the role of inevitability. I'd say medical marijuana is 2 steps ahead, and this one's still early in the right to die discussion. I mean, but you brought it up earlier about Brittany Maynard. The only reason why New Jersey had this discussion again was because Brittany Maynard was attractive and young, and the first Facebook physician-assisted suicide. The question is whether that will, it's an outpouring you will hear like those other issues I mentioned, or whether this is just a renewed interest in the right to die discussion. I don't think it'll reach that air of inevitability anytime soon. I think there are other issues that people and advocacy groups would focus on first.
You made a great point about the attractiveness of this, because that's what society is always drawn to. I only have about 45 seconds left, but I needed to ask your opinion on this. Quick story we heard today that people are being told they're allergic to penicillin without allergy testing, so they're falling for it. How dangerous is this?
It's pretty dangerous, and here's why. 94% of people in this new study don't actually have an allergy to penicillin. They were told when they were young they had it, and here's the problem. They end up taking medications that are more powerful than they need to be, which causes problems with bacteria in the future. It ends up very dramatically, those higher antibiotics, higher powered antibiotics have more side effects, and the cost is much more. So 94% of people are walking around thinking they have an allergy when they don't. What they need to do is actually get tested, talk to their primary care doctor, and not just sort of walk around assuming that's the case.
Just going to think to myself, if a doctor tells me I'm allergic to something, I'm going to say, and the proof would be? Get the allergy testing.
But people aren't doing that. And so that's what they ultimately need to do. In the long run, it'll be safer for them and for the population as a whole.
All right. Dr. Maz, always a pleasure to have you on the show, my friend. We're going to do it again real soon.
Thank you.
All right. Thanks so much. Short intermission. We're back later on this hour with the uproar over the Obama administration allegedly allowing fertility clinics to sell U.S. citizenship. And at 43 minutes after the hour, another step into the future for American military drones. So much more coming up on MidPoint, where we question everything.